What's up YouTube, Sierra here with DIY Dwight, and it is officially post-op day 8. So I have officially been in bed for 8 days recovering, and I thought I would just tell you guys a little bit about it and what you can expect and update on how I'm feeling. If you guys are new here, my name is Sierra and I just had hip labral tear and FAI surgery, and I'm putting together this vlog of weekly updates so you can know what to look for if you're having this surgery or maybe a loved one is having it or you're considering it. I don't plan to edit these videos and make them really fabulous. I'm just doing kind of a long stream and then gonna upload it. If you guys have any questions ever, don't hesitate to ask. And again, I'm not a medical professional. This is just my experience, so don't take any of this stuff as medical advice. I should also mention that a subscription never hurt anybody. So if you feel up to it, you could also subscribe to our channel. You'll be notified whenever I release a new video about my surgery and also see cool projects that Matt and I like to throw together around the house. Now, how am I doing? I'm doing great. I have discontinued almost all the medicine that I am supposed to take except for aspirin and naproxen that I take every day for 30 days, mostly for blood clot purposes. I am still wearing my brace, as you can see, every single day unless I take a shower or am riding my bike. I ride the bike for 20 minutes a day, and I have been doing that since day 4. Day 1 through 3-ish, it was only about 5 to 10 minutes of riding because you're supposed to build up to 20. Today's the first day that I haven't worn the ice machine, and that's been really cool. I've worn it almost 24/7 until today. At night, when sleeping with this brace can be really difficult, and so it's advised. My doctor just told me to do it whatever was comfortable, but obviously like turning over onto my right side wouldn't be comfortable. So I've been sleeping on my back and then moving over to my left side and putting a pillow in between my knees to keep my hips level. But I normally wake up back on my back, and this is uncomfortable. Being on your back day in and day out does start to create like a stiffness. So if you're having this surgery, you can expect, to have some discomfort there. But I was reading that there's a big difference between discomfort and pain. And the discomfort is only temporary. I went to my first PT appointment on Monday, and that was post-op day 3. And right now I'm just doing some really simple range of motion exercises. My husband has to pick up my leg and move it in circles, clockwise and counterclockwise, 30 times, 3 times a week. And then he moves my leg side to side. And then he also moves my leg up and back. And he only moves it far enough up to where it doesn't hurt. So just, you have to make that generalization for yourself, and you do a couple, and if it feels like it's hurting, then draw it back a little bit and do less pinching of the hip flexor. Now, as for showering, I showered on post-op day 4, I believe, so I was really ready for a shower, and this is the way that we figured it out to work for us. We have 2 showers in our house, and they're both tub showers, but our master bathroom tub is a deep soaking tub, and there's no way I was going to be able to get my right leg over the lip of the tub. So I'm showering in the guest shower, and we put a bench in there, but not a shower seat. It's a bench from our garage that is like put at the workbench. It's probably comes up to my hip in height. We wrapped the cushion in grocery bags, and I get assisted into the tub with Matt. Now, if you were by yourself, you could put your good leg on the edge of the tub and stand up and then ease your way down onto the bench. But it's been a great way to shower. Matt adjusts the shower head to spray directly on my head, and I can kind of lean into the water. And then also, at times, I'll stand up in the shower and just like let my bad leg rest on my toes. I just put it down, because you're supposed to put 20 pounds of pressure on your foot anyway, which is kind of hard to gauge. Basically, it's no weight, and if you put any more, you can start to feel it and you can just ease back. So I enjoy standing up, because laying in bed all day, like I said, can be uncomfortable. Which reminds me that I'm also supposed to lay on my stomach for 2 to 3 hours a day. And that can be kind of difficult, because on your stomach, you really can't do much. So what I do is in the morning when I wake up, I roll over onto my stomach for about 30 minutes. And then at night when I'm going to sleep, sometimes I'll start on my stomach to get another 30 minutes. And then throughout the day, whether, I'm reading a book or something, I'll lay on my stomach and read the book while I'm laying there. And that stretches the hip flexors. I am still wearing the compression sock things, the plasma flow, and those are just on all day, just inflating and deflating. That's for blood clots again. So this is the TINS unit right here. It just, like, you peel off these little things and you stick it on your body. We've been experimenting with this because the only instructions we received was to put it 2 inches away from the incision site, which would be tough anyway because my brace is in the way. So the first time I put it up here above the incision, and I really didn't like the sensation. So today I actually put it on my thigh, and that was a lot more comfortable. And then also when I lay on my stomach, I have Matt set it on the back of my thigh and also on my glute muscles. That's because people that have hip tears generally have pain in their groin, but there's other people who have hip tears that experience the onset of their symptoms in their glute, which is what happened to me. And so as I'm doing some of my PT exercises, I'll start to feel like that pain in my glute just so. And so I'll set this on my glute and it cycles for 30 minutes. With more of the PT exercises that I'm supposed to do, I have to flex my quad muscles 30 times while counting to 5 each time, and then my glute muscles, and then also my abs for 5 breaths 30 times a day. And I found that the quads are easy and the breath is easy, but the glute can be a little bit difficult. So I do 5 sets of 6 while counting to 5 each time. Being only 8 days post-op, I will say, like, how am I feeling? I'm feeling really tired of being in bed at the moment. Like, I just miss being mobile. I'm a very independent person. But of course I know this is all for the bigger picture, and I'm grateful, as well, to have Matt to take care of me. So if you're in the situation, you're wondering what it's going to be like, it can feel like a long time of just waiting. My next doctor's appointment isn't until Thursday of next week, and my next PT is next Monday, Wednesday, and Friday. And so it's really just being at home, being patient, and just like believing in the process. So it can be, difficult to be on your butt all day, day in and day out, but it's only temporary.
Maybe even a little boring.
Maybe even a little boring. I already read a book. I've almost colored through an entire coloring book, and today Matt's going to work on more Halloween decorations and I will watch. So stay tuned, subscribe if you'd like to. If you like this video, let me know by liking it. And if you have any questions at all, I'm an open book when it comes to this. I really want to help you guys because it's been a huge part of my life. So, leave your comments below and I'll get back to them as soon as I can. I plan to give you a 2-week update after my post-op appointment next Thursday.